If you've had plantar fasciitis for more than a few months, I'm going to tell you an interesting story that hopefully will be impactful to you. I had a patient come in who was in her early 50s, and she has had pain in her heels for over 2 years. She had seen a few other doctors, physical therapists. She tried all the home remedies you can think of for this condition, as well as she had treatment, physical therapy, cortisone injections, inserts. She still couldn't get relief. She was sitting in my treatment chair with her husband sitting in the chair next to her, and she had tears rolling down her face. She had a difficult time walking even a half block without significant pain in her heels. And she felt like she was at a dead end. She didn't really think that she was ever going to get better. And she came to me because she heard about something that I do called shockwave therapy. So first thing is, I wanted to make sure that I had the right diagnosis. We have an ultrasound. We took an ultrasound on her heels, and her plantar fascia was real thick. So what can happen is this plantar fascia here can get real thick. So it was more than 4 to 5 millimeters thick, which is almost double the normal thickness. And so based on her symptoms, location, ultrasound finding, my diagnosis was chronic plantar fasciitis. All the things she had done were fine, but obviously I wasn't going to go back and rewrite the book on that. So I suggest to her she has two options at this point. She can either have what's called shockwave therapy or surgery. And she certainly did not want to have surgery. She takes care of her grandkids and all of that. So we talked about shockwave therapy. And what shockwave therapy does is it increases blood flow to areas that just don't have it. And the plantar fascia is one of those things. Tendons and ligaments don't have good blood flow. So what we want to do is we want to stimulate the body, open up the blood vessels, and bring the cells into that area that can help heal that. So shockwave therapy has been around for over 25 years. It's evidence-based medicine. There's over 200 papers that are done every year, clinical studies that are done on the effectiveness of shockwave therapy. And if you add them all up, it's about 85% effective. After just a few treatments, this person who came in with tears in her eyes had the biggest smile on her face because now she could walk several blocks and she could take care of her grandchildren without this, grunting and grimace on her face consistently. And eventually, after about 7 treatments, I discharged her because she was pain-free. So this is a person that went from severe pain for 2 years to pain-free with a non-invasive treatment. So if you've been having pain for a long time and you've tried a lot of things and maybe even seen doctors, there's still an answer for you. Surgery is an option, but if you want to do it non-invasively and get back to the lifestyle that you deserve, you might want to check into shockwave therapy.